Ashraf from Bachelor of Science in Nursing, Level 2, Section 2B. And today I'll be performing the urinary catheterization. So let's proceed. The first thing that we'll be doing is assessment, in which we will be assessing our client's overall condition. If our client has the ability to cooperate with us during the procedure, and also we'll be assessing her if she is capable to be positioned in supine with her head relatively flat. Also, we'll ask our patient if she has an allergy with latex, since our gloves and our catheter is made up of latex. Also, we will ask our patient or our client when was the last time she voided or when was the last time she was catheterized. Then, we'll be doing a percussion of the bladder for us to determine the fullness or distension of the bladder. So we can percuss it here. So if the sound being produced is dull, therefore it is already full or distended. However, if it's tympany, therefore it isn't full yet. However, in the case of our pregnant women, percussing the bladder is not advisable because it may cause discomfort or it may cause pain to our patient. The next thing that we will do is to determine the most appropriate catheterization method that will be based on the doctor's order. We'll assemble all the needed equipment supplies, wherein we will be having our sterile catheter, our sterile gloves, our waterproof drape, antiseptic solution, our cleansing balls, the forceps, our water-soluble lubricant, urine receptacle, specimen container, our syringe pre-filled with water, sterile water, our collecting bag and tubing, disposable clean gloves, the blanket that we'll be using to drape our patient, and also our blanket that we will be using in creating our sterile area. After we prepare all the needed materials that will be needed in our procedure, we will then proceed on performing the perineal care to our patient for us to clean the meatus from gross contamination. So we will sanitize our hands using our alcohol to perform hand rubbing. So after that is we will put on our clean gloves. Okay. After that is we will now drape our client. After that is we will put on our drape to avoid contaminating the bed. Okay. So after that is we will be using this cloth. Okay, with the soap and the water, warm water. So we'll be starting from there. Okay, then we will discard it. Then we will get another one. Okay. Discard again. Then here. Discard again. Okay. Here. Okay. Then Another one is from perineal. Okay. Start again. So we already performed the routine perineal care. So after the preparation is we will then proceed on the actual procedure. So the first thing to do is we will inform our client about the procedure that we'll be doing, why is it necessary, and how she can cooperate with us during the actual procedure. So, good morning, ma'am. I'm Ash Rafael, and you are? Okay, good morning, Mrs. Rafael. Today, I'll be doing a urinary catheterization, in which I'll insert a catheter to your urethra for me to gather the urine to your bladder. So, for the entire procedure, I want you to cooperate and stay relaxed to avoid any problems during the procedure. After we inform our client, is we'll then perform hand washing or hand rubbing. So, we will perform this and observe any appropriate infection control procedures. Okay. So after we wash our hands, as well then provide privacy to our client. So if we're in a ward, we can provide privacy through closing all the curtains, closing the curtains. However, if there are no curtains, we can ask the relative to make a cover with us using a towel or a blanket. While if we are in a private room, we can provide privacy through locking the door or giving a sign at the door that we are already performing a urinary catheterization. Since we already provided privacy to our client, the next thing that we will do is to position our client in a supine position with her knees flexed and externally rotated, or what we call the frog leg position. So in which, ma'am, could you please flex your, we will just flex your knees. Okay. So after we position our client, is we'll then provide adequate lighting. So for us to properly see the perineal area of our client in performing the procedure. And since I'm a right-handed, I'll be positioning myself on the right side of our patient. So the next thing to do is we will place our urine bag just near the area for us to easily access it during the procedure. And the next thing is, if the agency policy permits us to use silocaine gel, we can inject 10 to 15 ml of silocaine gel in the urethra of our client. Then the next thing to do is we will place a waterproof drape under the buttocks of our client, in which we will ask her to just lift her butt a little bit. So we will place it without contaminating the center for it not to be contaminated. Okay. This is to avoid the bed from being soiled. Okay. After that is we will go into this part for us to prepare a sterile field. So for this, we will be using this blanket that serves as our sterile area. Then we will get some our forceps. Using our one. Okay, after that is we'll close it. Then we will open our lubricant and just place it here. Okay, after that, discard it. We peel. Sterile gloves. Okay, after that, place it here. And then our catheter. Okay. The next thing to do is we will now put on our gloves. Okay. Okay. First. So after that is we will discard it and put it here. Now, our hands are already sterile, so we can now open our catheter. Okay. Then, we can now discard this plastic. Okay. Then we can curl our catheter into our non-dominant hand. The next thing to do is we will attach the pre-filled syringe into the indwelling catheter inflation hub to test the balloon. So we're doing this to test the balloon if it's working or not, in order to avoid any problem or complication during the actual procedure. So I'll handle the indwelling catheter inflation hub into this part, the orange part. So we'll now insert the syringe. Okay, we will test if the balloon will inflate. Okay, the balloon inflated. Okay, so we already tested. Okay. After that is, okay, we will now the next thing to do is we will now put our transfer our catheter into my dominant hand, which is my right. After that, we'll just put it down, our catheter. Then we will put our lubricant into my left. Okay, just here. Avoid touching the gloves. Okay, after that we will then put it back. To that is we will now curl again. Okay. So in applying our lubricant, we will just apply the lubricant on the side where there is no hole. Okay, on this side. Let's avoid applying the lubricant on the hole. So start. So after we apply the lubricant to our catheter, we can still attach this catheter into our drainage bag or into our urine bag, since we will still get the urine sample of our client. Okay, we will just put it here, still here, for a while. Then let's move on into our client. So now we already drape our client accordingly, which is in which we only expose the perineal part of our client. So after that, as we'll then proceed on the procedure, we will clean the genitalia of our client. So we will use our forceps. Then we will grab a cotton ball with the antiseptic solution. We will spread the labia. Okay, we will start cleaning from the side which is far from us. Then we will start from the top into the bottom, which is from cleanest to dirtiest. Then we will discard this. Okay, we will get another one. We will do the same procedure from top to bottom. Okay, discard from labia minora. Okay, discard. One again. Discard. Then the last one is at the center. Discard. After cleaning the genitalia of our patient, we'll now proceed on inserting the catheter. Okay, we will now wherein the catheter will be coiled into our hands. Then we will grasp the catheter firmly about 2 to 3 inches from the tip. Then we will ask the client to take a slow deep breath and insert the catheter as the client exhales. So here, my non-dominant hand will be holding or will be spreading the labia of our client. Then my dominant hand will be handling this catheter. So, ma'am, hinga po tayong malalim. Okay, 1, 2, 3. Okay, we already inserted the catheter into the urethral meatus of our client. If the catheter is already inserted in the urethra, we'll now advance the catheter 2 inches further after the urine begins to flow through it. So, and however, there are some instances that if the catheter is being accidentally contacts the labia or slips into the vagina, it is considered contaminated already. The thing that we will do is we let the contaminated catheter left in the vagina, and we will now insert a new catheter to help avoid mistaking the vaginal opening for the urethral meatus again. So the next thing that we will do is we will now, I will now hold the catheter using my non-dominant hand. Then I'll get the syringe. Okay, we will now inflate the balloon. Okay. So in inflating the balloon, if the client complains of discomfort, immediately withdraw the instilled fluid. Then we will now, after that is we will advance the catheter further and attempt to inflate the balloon again. So after that, after inflating the balloon, okay, we'll just remove it. Then we will pull gently the catheter until resistance is felt. Okay. This is to ensure that the balloon has inflated to its place and in the trigone of the bladder. After we inflate the balloon, we will now collect a urine specimen if it's needed. So we will just allow 20 to 30 ml to flow into the bottle without touching the catheter. Okay. So let's assume that we already get the 20 to 30 ml. So we will now put the urine specimen there. After we collect the urine specimen, we will now attach the urinary bag or the collecting tubing and the bag into the catheter wherein we will ask the client to lift her leg. So after that, okay, then we will remove, then we will attach. Okay, so we will just do that, and we will now the thing that we will do is we will deliver the urine specimen that we collected to the medical technologists for them to examine. So in some cases, only 750 to 1000 ml of urine are to be drained from the bladder at one time. So after that is we will secure the urinary bag. So the urinary bag is already at the side of our client, just below the bladder of our client. This is to avoid any reflux. Already collected the urine. The next thing that we will do is we will deflate the catheter. Okay. We will deflate the catheter. Okay. Then we will remove the catheter. After that is our patient remove it. After we remove it, we will now put this into the container. So after that is we will wipe the perineal area of our client. Okay, we'll wipe. If there are any remaining antiseptic or lubricant, so wipe. Okay. Then we will get another one. Okay, we will get another one. So we already clean the perineal area of our client. So we will now cover the perineal area. Okay. Trigger again. So after that, we will return the client to a comfortable position. After that is we will discard all the supplies in appropriate receptacle and we will wash our hands. So we will remove now the gloves. Then we will put it in a receptacle. Then we will perform hand washing. So after that is we will document the catheterization procedure, including the catheter size and results in the record. So that's all the procedure of urinary catheterization.